All right, folks, welcome to the Marketplace Show Reset and Jumpstart. I'm Anthony Weeks, and I'm joined by my colleague, Linda Dorman and Yvette Wood. Weekdays, we come before you each and every week, and we bring you segment number 1 on health and wellness, also known as Our Health, and also there's segment number 2 and 3. We're broadcasting on multiple platforms on Tempo Network Television. We're broadcasting on WSDX Radio. We're broadcasting on WSDX Bloomberg. We're broadcasting also on social media. But most important, we're broadcasting on several of the platforms via YouTube and also Facebook. Our Spanish platform is La Mega Mundial, and we're broadcasting on Jumpstart TV. And so we welcome you to the program and my colleagues. Ladies, how are you doing today?
Very well, thank you. How are you?
Busy, good busy.
Good busy.
Yes. What about you guys? What's going on in the Washington, D.C., Maryland, Virginia area, better known as DMV?
Well, let's see. Yvette, from your perspective, what's happening?
We are keeping a close eye, of course, on this Delta variant here in the DMV. Mask mandates are changing from county to county and encouraging everybody to get their vaccinations who have not received that. And those that have, we're encouraging them to protect themselves up here in Montgomery County. How about you, Linda, over in Prince George County?
In Prince George's County, we're doing exactly the same. I'm the mom of high schoolers now this year, and circling all the policies and new procedures for mask wearing.
Okay.
I'm sure the schools are coming up with their policies as well for the schools. I have school-age children as well, and still waiting to see what they're going to do, Anthony, as far as, the children being required to wear a mask or not for this upcoming school year. So
yeah, Governor,
close eye on it.
Our Governor Albert Bryan Jr. By the way, here's a little trivia. I don't know most people know this. In the entire United States of America, Albert Bryan Jr. is the only African American governor in the country. Didn't know if you knew that.
Wow, did not know that. Thank you.
So Governor Bryan, the governor of the United States Virgin Islands, is pretty much he's being extremely proactive in terms of just really, trying to really stay ahead of the pandemic. We have during the height of the pandemic in 2020, we had no more than 8 people hospitalized.
That's amazing. That's amazing.
Right. Now it's totally the opposite. In 2021, because of the Delta variant, we have 18 people hospitalized. And I think that the death toll is 38 to 39 people who have died from COVID-19, the virus. And they're saying that I think right now the 18 people that are in hospital are 100% are unvaccinated.
Wow.
So that speaks volume. Wouldn't you agree? That speaks volume in terms of what we're seeing out there. Obviously, we now know that Florida and Texas are now account for a third of Florida is now the epicenter of the pandemic, and both combined Florida and Texas are accounting for a third of the cases of COVID-19 in the United States.
Oh, absolutely. I mean, you think of the policies for Texas, they were one of the last states to introduce masking. They never quite made it, a statewide mandate. And then you look at Florida as one of the vacation capitals, and they too allow people to remove their mask and socialize quite early during the pandemic. And so now here's the end result of not taking it as seriously as they should have.
Yeah.
I know we have a guest and we're going to bring her on shortly. But what I am really perplexed about, what I don't understand is Okay, so I thought I understood when those who are purists, naturalists, don't want any chemicals in their body. I get that, right? And so they resist that, right? But if you realize these are the same anti-vax folks are the same people who are anti-mask. Now the
Yes.
mask, that's external. You're not putting anything in your body. You're literally putting it. It's a line of defense, right? It's a shield to protect both you and everybody else. So, how do you explain the same people who are anti-mask or who are anti-vaccine were the same people who are anti-mask as well? And also social distancing. They don't want anybody to tell them what to do. They're just completely defiant. I guess it's just
I
human
think
nature.
I think that's it, Tony. I think that's it. When I was talking about Prince George's County, I'm not sure who pulled the plug, but I got pulled a minute ago. But glad to be back on the show. I would say that you made a very good point. And when we have an opportunity to talk to Ms. Drummond, we can talk about policies, but I think it's also practice and habit. And we have a norm of our democratic society where we don't appreciate being, quote unquote, told what to do, even if it's in our best interest. And so we allow for that free will, that freedom of decision making. So that's why it's not the law of the land. It's still at the mandate stage. And, we've seen just scenario after scenario where individuals are almost risking their lives in telling people coming into stores to put their mask on, making sure that families who risk super spreader events only to then realize it was a mistake when they have their precious loved ones succumb to COVID and COVID related diseases, even or suffer as a long hauler. So we are a society that needs to experience many things before we really get it. And unlike other countries, over the year, we've had this conversation with many guests and amongst ourselves as host of this program. Why can't we just wrap our minds around a new behavior that's going to actually succeed for us in beating COVID? It's something to really dive into.
We have someone, a guest who you're going to do the honors of introducing, but is doing her part in her enterprise in the healthcare space. And it's always an education, right? Not just for our audience on television, and radio and social media, but certainly it's an education for me. I always consider myself, I'm a student for life. I'm always willing to learn. I don't know. I always say I don't know anything. And so with that frame of mind, I think I'm always availing myself to learn as much as I can. And so I'm, as usual, looking forward to the engagement this afternoon.
And I'm with you, and I know that Yvette is as well, which is why we are so pleased to always invite amazing guests like Jean Drummond to come on and just share their wisdom, their knowledge, and their experience in helping us to understand this landscape of healthcare overall, and not just here in the U.S., but in all of the places we broadcast and have viewership. So I am just so pleased and delighted to introduce to you Jean Drummond, here from the DMV, specifically Prince George's County. She's president and chief executive officer of her own company, HCD International. Jean is a dynamic and knowledgeable healthcare professional with a vast experience providing executive oversight on extensive quality services across the federal, state, county, and community and healthcare sectors. So a very broad reach, and we appreciate that. We even more so appreciate that Jean's strength lies in her ability to bridge gaps between health policy, program implementation, and access to care for our most vulnerable populations, very critical. She began her company in 1991 after a successful career as a practicing clinician, so a worker in the healthcare sector herself. And so Jean received her undergraduate degree as a physician's assistant from Howard University, good old HU here in Washington, D.C., yes, and earned her master's degree in public health administration and healthcare management from Bowie State University, right here in our hometown of Prince George's County. She is also devout mother and wife of Dr. Jimmy Drummond, a veteran of the U.S. Air Force, and is recognized her divine purpose in life. Jean realizes her success rests in giving the greatest gift of all, love and service to mankind. And I'm also pleased to share that Jean and her company and her team have founded an amazing nonprofit organization that does just that in terms of giving back to the community. Welcome to the program, Jean.
Thank you. Thank you. Thank you.
That's right. Welcome.
Good. Good.
So before I transition out and let you ladies do your thing, there's something I feel sort of inclined to say. Okay, do you recall during the 2020, in the height of the 2020 pandemic, when it was those who were most affected by the pandemic? It was people with immune compromised conditions, people of color, and older people.
Yes, absolutely.
Now, Delta is pretty much saying, I'm not going to discriminate. I don't care who you are. Okay,
absolutely.
You are at risk. And so one of the things that back in 2020 and today, there is this whole, if you will, conspiracy notion that this is somehow a way of targeting people of color. And the reason I bring this up is because for people in radio land, right, obviously listening to us on radio throughout the Caribbean, and also on television, listening throughout the United States and throughout the Caribbean and in South America, the majority of the guest contributors to this program and analysts to this program are women of color and women of leadership position. So the information that you're hearing, this is not somehow some sort of concocted conspiracy to try to misguide you, misinform you. The information that you're hearing and the voices you're hearing are women who are literally, these are medical professionals, medical experts in the space of science and medicine that are sharing this information with you. And so I wanted to be able to say that because to this day, we're still hearing about the whole vaccine is meant to do something to people of color. It's some mass something. It's always something. So I just really wanted to put that underlining thing there so people understand, who they're getting their information from and not take the information with prejudice.
Sure. Anthony, I mean, that is an absolutely, thank you for that intro. I really appreciate that. And, I heard you earlier when you were speaking about the anti-vax versus the anti-mask, right? I mean, as a world, we have, the immunizations and vaccinations has been something that, we can trace back for many, many years. And you're right. I mean, COVID does not discriminate against age, against wealth, against race and ethnicity, certainly. But I will say this, I think when we think back to it, clearly COVID has unmasked something that we in this health space have known for quite some time, and that is around equity and disparities. And so, clearly we know that minorities, racial and ethnic minorities are disproportionately represented when it comes to such things as diabetes, hypertension, and multiple comorbid conditions. Much of this is because of what we know, something I'm very passionate about, is the social determinants, typically called in the literature, the social determinants of health, but we drive a different, a broader context, and we refer to it as the social determinants of life. Because when you think about whether you're talking about infancy, childhood, teen age, early adulthood, middle age, or seniors, clearly the factors of food insecurity, access to food, access to good health care, transportation, housing, physical and, and emotional, emotional abuse, whether you have electricity for your, if you are running out of, electricity has been turned off, and your refrigerator that was holding your insulin is no longer is now cut off. So because of the disproportionate, those economic factors that really impact one's ability to have good health, right? And health is beyond just good medicine. But, health is certainly mental health when we speak of whole person-centered health. So you have, this infection, COVID-19, whatever, we're not going to spend our time where it came from. What we know is, as a country, we have over 612,000, right? 612,000 lives have been lost.
Yes.
Okay, so I get it. I know there's been the concern of what was on the death certificate or what have you. But what we know is those individuals are no longer with us. Okay, Linda, Yvette, can we all consent? Those individuals, and there was something in common across all of them, right? So
Absolutely.
when I'm talking to individuals that have heard, I listen, right? I don't play the blame game. I listen because there's a reason why we have vaccine hesitancy. So we listen, right? We do know there have been challenges. We all know we all know the different, reasons why, and that, there has been those disparities. But I like to listen. So here again, we can do just what we're intending to do on this broadcast, and that is to educate. So I will say, and then, at the heat of the battle, at the heat of the battle, we've had over 3,300 people die. Die. Actually, I was looking at some of the data around Latin America and the Caribbean so far, and just there, it's been 41,000 infections, and and certainly many of them, I see here the data is around 1,380 deaths in the Caribbean. But this is also a fact that I saw. One out of every 100 infections last reported around the world. I believe this is 13 are reported from countries in Latin America and the Caribbean, which is critical. The region currently is reporting 1 million new infections every 11 days.
Isn't that something?
That's huge.
That's mind-boggling when we think that we're how many months into this pandemic?
Right. Absolutely. So, but let me bring a broader context to this, and I really appreciate.
And before you continue, because I have to now step back I want to be able to. There's a big debate here in the U.S. Virgin Islands on radio.
Okay.
In terms of everybody now is a doctor, everybody now is a scientist, right? Everybody's an expert, right?
Yes.
And so the debate is now, and I want to throw this at you guys because you guys are medical professionals. You're in the space. You're doctors and nurses, and obviously executives in the healthcare space. And you are women and women of color. Okay. What? And you don't have to answer right now, but at some point you do. The debate is that what we're getting from Pfizer and Moderna and Johnson and Johnson and the other drug companies, pharmaceutical companies, they're not vaccines, they're shots. So can you help our audience? Look at Dr.
And is that, Anthony, is that controversy coming from the sheer fact that the FDA has not issued its final approval because Pfizer is
I don't know where
first
it's coming
up?
from. That's what I'm saying. I'm putting it out there to you, so our audience, our dear audience, on television, on radio, but particularly in the Virgin Islands, the debate on radio for the past couple of weeks that the vaccine we're getting, or the whatever it is we're getting, the COVID whatever it is, it's not a vaccine, it's a shot. What's the difference between a vaccine and a shot? Is it a vaccine? Is it a shot? Help our audience to be able to understand that. I'm going to step back, and at some point you guys can answer that, but you don't have to do it right now.
Oh, we're going to have to answer that right fast, because that, we don't want to leave anyone without an answer to that very critical semantic-based question. Yes. How dare you step back? You better sit right there and get that answer. So who would like to? Jean, would you like to tackle that? Yvette? Who would like to tackle that?
And make sure you give your credentials. Make sure give a quick credential before you answer, please. Okay, thank you.
Yeah. Well, so I'll take it. I'll take it, and then Linda, certainly. So I'm a physician assistant. I want to be clear, I no longer practice as a physician assistant, but I practice with top physicians that are, advising nationally. I mean, that have been a part of the vaccine trials and are following this on a daily basis, creating policy for, countless individuals that look like me, that are very, very concerned about particularly minority populations. So indeed, it is a vaccine. Now, is it given in a needle, which is considered a shot? I mean, I wanted to ask you, Anthony, what's the definition of a shot? I mean, are we talking?
I don't know. I've been told that there's a difference. I've been told that we're not getting a vaccine; it's a shot. I'm trying to understand.
There's no difference. Let's be clear. Let's be very, very clear. So everyone under the sound of our voices, we have expertise that have been at bedside, who have worked extensively with the scientists, who are part of the policy development process. It is a vaccine. Maybe we should all say that in together. It is a vaccine. A shot is just simply another way of saying it if you must, but let's not say there's a different pathology in what you're getting in that vial that you're getting. You're getting a shot of a vaccine.
Right.
How about that?
And I'll
Does that clarify?
We've had the opportunity in a project that we're working on. We've given, actually just yesterday, we hit a milestone of over 30,000 vaccination shots. All right, so we provided
I like a vaccination shot.
Okay. Vaccination in what's in the vial. We see it, they come sealed. I mean, it is a vaccination that we are giving according to the direction of CDC, the direction of the state, certainly the county, and those directions. And so it is indeed administered as a vaccination shot. It's not something you drink. It's not something you inhale. It's not something a patch. I'm trying to think of all the ways that that medications or, medical,
how it's assimilated into our body.
Exactly.
And so that's our segue.
Needle in a sterile needle under sterile, in a needle, and is administered. Yeah.
And HCD International is the administrator of those shots, correct?
Yeah. So we are. So this is an opportunity that we have in working with the county, Prince George's County, to support them in their, incredible multi-pronged, multidisciplinary, science-led, evidence-based led strategies to administer the vaccine and to really address the pandemic.
Well, we'd like to hear a little bit more of, because we have the second half of the program to really do a deep dive into the policy, because everything that we're doing is driven by a policy. And it's so impressive to me that you're sitting at the sideline, at the table, helping to give some direction, give some advisement through your company. You're a woman-owned, minority-owned company, founded in 1991. I love your bio that said, with $400 in your mom's house, as we do, we did. And so here you've got a tremendous amount of insight that we need to, in the time that we have. But tell us a little bit more about your company, because it's pretty dynamic and pretty comprehensive.
Sure. I'm happy to. As you shared, I was a physician assistant and really working in the practice in Washington, D.C. and Maryland, and really began to see healthcare beginning to transform in a way that I felt it was really leaving the most vulnerable behind. Mm-hmm. So I decided, who is this making these policies? How can I really have a systems impact? So it was really at that time that Healthcare Dynamics, that's what HCDI stands for, Healthcare Dynamics International, was founded. And we began working with the United States Department of Health and Human Services, particularly the Centers for Medicare and Medicaid Services. Mm-hmm. And let me be clear, I want to make sure that I'm really clear. I am not a government employee or an official. We are a contractor that has had the opportunity of working on multiple prime and subcontracts with the Centers for Medicare and Medicaid Services. And within that, privilege, we've had the opportunity to really share the voices from the ground. We call ourselves the policy to practice group, right? So we refer to and study a lot of the policy making, whether it's economic, the healthcare policy, and really how do these policies impact the providers, the patients, and the systems that are on the ground, the communities, right? We all know that health is in our community. We don't spend time, we spend how many hours a year in the doctor's office? Hopefully 0 or much less in the hospital. We spend our life in our community, right? Near our grocery store, in our homes. And if we don't have homes, if we don't have food, it is really hard for us to make sure that we have good health care. So one of the focuses of HCDI is really looking at the various policies. We know some time back under the Obama administration, it was the Affordable Care Act, right? That really improved the access, health insurance, making sure individuals that did not have, that were uncovered, could now be covered. And then after that, one of the next policies, the large policies, was Macra, the Medicare Access and Reauthorization Act. Macra really changed the way doctors and systems are paid for delivering care. We're now really moving from a system of fee for service, meaning every time you show up to the doctor bills for service, to what we're now calling more value-based care, right? So that, it's all about the quality. We want to ensure that we're now being paid for value. So is your diabetes, it's one thing that you came to the doctor 5 times a year, but your A1Cs, your eye exams, you still may not have really progressed in the quality of your care, right? Versus now, quality of care, we want to make sure that doctors are really in the driver's seat with the patient, and that the doctors, the provider, let me not say doctor, the appropriate word is eligible clinician, receives compensation for truly improving the quality of care of that patient or that person.
And so then how would that take place? Because I know that Yvette has some great questions that she wants to ask, and probably has some great experience in extending, just on this one comment, extending that healthcare beyond the in hospital, if you arrived at the hospital, to now in and back in the community, so that there is a case management concept around that patient, so that they're getting that care and coming back. So they're not coming back into the hospital for any. Is that how we equate value outside of healthy outcomes? Because at some point, it's the responsibility of the patient to be a willing participant in their own health care. So how can we put the complete onus on the healthcare system in this new value-based reimbursement scheme or apparatus?
Good. Linda, I'm so glad you asked, because there's more to the story. So I think I heard you mention Yvette may want to ask. Did you want me to answer that, or did we want to?
Yvette, I know you had a burning question, because we were talking about it earlier today. I said, oh, this is your jam. This is your jam. What's your question? Just to make sure that we're bringing it all out onto the table here.
Right. Sure. Jean, so when we were in the height of this pandemic and everything got shut down, we immediately had to go to what? Telehealth.
Telehealth. Yep.
As I was at that time employed as a director of clinical services, I had no policies on telehealth.
Yeah.
So if CMS came in to do a survey and asked me where were my policies on telehealth, I had none, because it didn't exist. And with this massive expansion that we have now, I have to ask you, how much attention or how much concern is there for policies governing telehealth? Because telehealth is expanding more and more every day.
Absolutely.
And CMS, let's just, for our listening audience, CMS is one of the accrediting organizations that will come in and accredit healthcare providers.
Yes, they do.
To make sure that they're meeting a certain healthcare standard. So
yes, they do. Yes, CMS has an incredible vision, and they are very concerned about health equity and health disparities. So let me just kind of say to you, Yvette, I think, COVID caught so many of us off guard, right? I mean, let's just be clear. and we had to pivot quick. And it was happening so fast. It was not the curve went, up fast. And so I think that the beauty of it is that one, we have uncovered that we can do business differently, right? That we can engage more technology, right? But even with that, think about telehealth. And I'm always going to bring it back to my health equity lens. One of the things that I normally always have my magnifying glass with me that I talk about, health equity and that lens, is that think about broadband. Think about access to the internet. All right. And let's think about many physicians that are serving in underserved communities that may not have access to all these tools. Right now, in some cases, the telehealth for a minute there became FaceTime. If your patient had FaceTime, I could see you. And that's the way, it literally kind of went, because I don't have the technology, and then I don't have the money, right? It hit all of us, and the doctors at the practices, we had to close for a while. So that meant they weren't able to bill, many of their staff were laid off. It was quite a place where we were all trying to figure out the next lane. So I believe that in looking at many of the policies that are now going to be moving forward are embracing, telehealth really works in a significant way. So I think COVID really enabled us to fast track many things that were on the way. I knew many practices that were looking at getting it. And they said, I'm so glad we were kind of down. We just needed to push the button. Others, your laggers. So you had some early adopters and you had some laggers. And so I would say that many of the policies that had to be implemented are continuing an evaluation to determine how best do we continue them in a sustainability. And I will say, unfortunately, I think that we are headed for some, again, areas of unknown and some repeats. And so I think one of the biggest things that I talk about is our lessons learned, right?
Absolutely.
Let's make sure that we are capturing what went wrong, what went right. So indeed, in the event that we do have to go back and, go back into a shutdown, what are some of the things that we can learn.
And Jean, one of that's brilliant. I think year long we've just been collecting data, we've been getting more information, but we haven't started to close out with that lessons learned report in order to then move to the next evolution of response. And so that's a really critical comment that you made, because one of the lessons learned that I would think that we would put into play is the fact that we have to now look at side by side, not only the policies as an example, our telehealth, using that as an example, but side by side to patient rights, because I think in some cases, telehealth became subjected or subordinated under patients' rights if there was any fear of a spillage of health information, and that health information is protected under HIPAA. So then you put your providers in kind of this do I or don't I? How do I? How don't I? And what's the litigious or legal ramifications? Because I can't afford to be sued if someone's in the background listening to this in a telehealth environment and I haven't figured out, because you can't put a shield around other people in their home if someone's listening. Then you have an issue.
So Linda, I think, I know I want to kind of get back to some of the work around the transformation, because that's really, I know what we talked about, but there's so many pieces, and maybe we can have a next step.
A part two.
I got a part two. I got my health equity lens, but I think that one of the things that I do want to speak about is, you mentioned the data. And, as we move forward in our value-based care transformation journey, from many of the, what happened?
We can hear you.
Wow. Everything went.
Well, we can actually hear you. So you're in good state.
Yes.
Can you see me?
You're just frozen, but we can hear your voice, and that's critical.
Okay.
We can hear you.
Okay.
Sure.
We'll keep going. We'll keep going then. Jessica, please come. All right. So for some reason, it just, my whole screen went
Well,
white.
I tell you
So,
what, Gene, why don't we do this? Because when Anthony comes on, that means that we have to go for a quick commercial break. We have plenty of time after the commercial.
Let's take a break.
No problem. So I'll keep talking until I can't see you.
No.
It's fine. What I wanted to share with you is that, you know, when we think, as we move forward in this value-based care transformation journey, the integration and the sharing of data is going to be so important.
Okay. Yeah, her computer, she's having technical issues on her end. So obviously, let's use this opportunity to take a break, and hopefully she calls back in shortly while we're taking a break, and then we'll take it up from there. All right, folks, this is the Marketplace Show Reset. This is segment number 1 on health and wellness. We have actually real experts. We have people who understand the field of medicine and science. These people are studied, educated. You know, they got the stamp of approval. They know something about this, and these are women who are women of color. So, you know, take it for what it's worth. You know, this is the kind of information. These are nuggets. And you take with it and do with it what you want, but you can't say you're not getting it from a trusted, reliable source. This is the Marketplace. We'll be right back.
Small business is a part of all of us each and every day. It's where we eat, it's where we shop, it's where we go to meet our friends and
back to the Marketplace Show Reset and Jumpstart. This is segment number 1 on health and wellness. We broadcast each and every Wednesday, led by my colleagues who are experts in the health and medical space, Linda Dorman and Yvette Wood. And our special guest this afternoon is Gene Drummond. And we're broadcasting on WSCX Bloomberg Radio. We're broadcasting on WSCX AM 970. We're broadcasting on Tempo Television Network, on La Mega Mundial, on Caribbean Passport Magazine, as well as also across several other platforms as well. Linda, continue doing your part, man.
Well, we're just going to hop right into it because as this hour goes by so quickly, we have a lot that we want to share with Jean, and we want Jean to share a lot with us. And so, Jean, make sure your system volume is turned up, because we're just going to just hop right back into what we talked about, the role of the patients, healthcare transformation. You do it. So let's just make sure that we can hear you. Are you muted? Just turn your volume up. Maybe we can just turn, there you go. Now you can unmute yourself. We see you. Nope. Just unmute. Uh-oh. Nope, we were not able to hear you, but hold on. We've got a way that we can do this. I'm going to bring you up on to our secondary.
I got you.
Let's see, does that work? Yes. Uh-oh, I'm not sure we can hear you. So Jean, we want to hear every good thing you have. I don't know if the volume is up on your laptop, but if you're able to hear me through our backup plan, just turn your volume up.
Yep. Okay, we got you.
Yes.
Outstanding.
Good. You can hear me, and I can hear you well.
Okay, so let's just hop right back into the conversation prior to the commercial, and that's the role of the patients. We love your assistant. Let's give her a hand. Because technology and healthcare go.
No, absolutely, you do. So let me just take a minute, and I really want to lay some solid foundations. And team, we will have to come back because there's so many different pieces of this that we could go off to the telehealth, we could go off to the data piece. I mean, you can imagine this transformation process is being driven by many economists, policymakers, legislators, physicians, clinicians, nurses, and so it's big. So I'm trying to kind of distill it in a way that we can really leave some meaningful takeaways to our audience. I mean, I want to make sure that the mom on the call that has 2 children understands the importance of her even getting the immunizations for her children before they go to school. Or the grandma that may be on the call that has diabetes, that her grandmother had diabetes, her sister has diabetes, and maybe someone went blind and lost their limbs, but she doesn't have to.
Yes.
Right? Yes. So that's who, or the gentleman that may have high blood pressure but feels great until he has the stroke. So I want to talk about, I want to.
And can I add one more to that, Jean? And this is something that maybe all of us has experienced, where I'm not the one that's actually having the health crises, but I'm the one helping to navigate this remarkable and complex compounding healthcare system to help my loved one, whether it be my child or in particular, my elderly relative. That alone can send me into a healthcare state that I don't want to be into in terms of stress management. So give us some insight to that.
Sure. So Linda, I appreciate you saying that, because that's where we call really the caregiver. And there's a whole nother role for the caregiver and the advocate. We call that patient and family engagement, right? And so if I go back to transformation is all about the payment. Let's just be real. Right now, United States, I think some of the latest data I saw, we spent 17.7% of our gross national product in healthcare. But yet we are, our life expectancy, yet we are, I think the latest I saw is 16th in the world. So we've got some real issues. We are, our children are dying. Look at look at maternity. Maternal health, especially among African-American women. It's just the data. Look at our diabetes. Just the amount of money that we are spending and the economic productivity that we're losing because of our obesity. And it's just, I could go on in talking about it. Remember, I said earlier, the social determinants of life. Yes. So we could give you statistics from the babies to the teen pregnancies, just to, even if we think about mental health, right, behavioral health, and just suicide rates. So let me just say, that is why we are here, trying to drive change in a meaningful way that is also culturally competent. The United States is an incredibly diverse country.
Yeah.
And what works even when we think about segmenting, even for an African-American woman or a Hispanic woman in Boston, is very different, than an African-American and her needs maybe in South Texas, right? It's just different. There's geographic differences, whether we're rural or urban, whether we speak, whether we are married, maybe unmarried, whether we are, educated, uneducated. And so our strategies to drive health and wellness have to be as diverse, right? I mean, that's so very important. And oftentimes our systems have not been. It's been kind of a one size fits all. So now as we move forward in value-based care and transformation, there's several players here, and I'm going to really make this simplified. So I know there's the farm and there's so many, but really when we think about the patient and the family, the doctor or the provider, the clinician, the eligible clinician, which may be a nurse practitioner, we also think about, also the community health worker, right? And we think about then the community that they live in. So there is a compendium of services and transformations that are needed for each one of those. And I already simplified. This thing is so complicated, so many different layers. But what I would like to do is really focus on the patient, the member, the person that is accessing healthcare. And so I would say to them across, whether they are, highly educated or have their GED or in high school, you gotta certainly begin to take an active role, right? You may not have everything that you need, but we do make choices. Yes. We make a choice as to whether we pick up that bag of chips, that big bag of chips, that supersized bag of chips, or we pick up an apple. Now, I get it. Jean, I've got 3 kids, and I got to keep these kids, fed because they've been at school because of COVID. And all I can buy, I had $5 when I go in the grocery store. And I got to buy something because that apple, little John is going to eat it like that. I do understand, and that's why we are working on so many strategies to address food insecurity, food deserts, food swamps. Know the difference between a food swamp and a food desert?
I've never heard of that difference.
Yeah.
Okay.
So, you've got food, but it's very unhealthy food. I won't name the brands because I don't want me to get all the haters, but you all know some of those fast food and just high salt, high content. And the types of stores that are often in the lower income stores. They're called convenience stores. They're not convenient to your health. They're convenient because they may be right around the corner.
And is policy driving that? Is policy driving transformation in those communities in terms of those food swamps?
So, Linda, I told you this is multifaceted, right? I mean, so this is why even on the local level, if you see all these, come on, we know in some zip codes, you definitely see a higher number of spirit stores, or we call them liquor stores, all right? So let's just go. Let's keep on going down that lane. In that same zip code, I guarantee you'll also see a dialysis center.
Yes.
Okay?
Absolutely.
Let's think about it. Let's just think about it, right? And unfortunately, in the same community, you might find a higher rate of crime. So what I'm saying to you is that when we think of HCDI's policy to practice, it's not just health policy. It's housing policy. Look what CDC is working on right now around evictions, right? It's education policy, right? And that's when we talk about, I'm going to say the word structural racism, right? But we have to also help ourselves. So how do we get engaged? That's why when people say, I don't want to vote, really? You don't want to understand some of these policies? So we've kind of gotten off, in talking, but there is so much that I could say that I think we need to be more engaged in policy making.
No, I think it's all interconnected. I honestly,
I
I see the story and the connection, the puzzle pieces that you're putting out. And we will do a part 2. Thank you for agreeing already to come back. As a matter of fact, we probably need to do that next week so it's fresh on everyone's mind.
Absolutely.
Because one of the things that you just mentioned is structural racism, and we just got to say it out loud.
That's a whole
because, yes, because you're inside of this bubble that's looking at all those 4 corners within that structure, if you will, called social determinants, and then dealing with the policies that go from policy to practice. How do we then change it? And what can we do? Is it at the voting booth that we start our individual healthcare practice? Is it?
Well, I'm going to go even better than that. I think you can do it right in your own kitchen, right? And I want to say that I did not succeed in this game because I come at it in a blame game. I don't. I keep a mirror. If you were to really see behind my desk, I keep a mirror. It's not just to make sure my makeup looks a little bit right? But it's really to say, Jean, what can you do, right? What decisions and what, Jean, you can stop shaking salt.
Right.
You have a family history of hypertension. You make the choice to pick up a salt shaker and shake it. Jean, you can move away from the table and not take in as many calories as you may wish to take in. So, it's things of that nature that you can say. And so, yes, it is important to vote. There are multiple areas. And so I'm very adamant about saying, don't say somebody's not treating you right or has not given you the chance to do. Have you done everything that you could do? Have you turned off the television maybe and picked up a book, right? Are you sitting and putting your children in front of, these games or social media and letting them choose their idols or their role models? And or are you saying, no, we're going to read a book. We're going to learn to read. We're going to have healthy channels that we can learn about maybe, doing something. And so I'm just saying today we can do a 3-part series on just transformation at the ground level. Not going to I'm telling you it's policy, but at the ground level, and we can talk about the provider, and then what are some things at a community level, because I believe if we are really going to transform healthcare and even at an economic level, we've got to make sure that our communities are sustainable, that we've got places we walk.
Wouldn't you agree that this structural racism we're talking about also have a lot to do with the lack of community education? I mean, it goes to the scripture that people perish for lack of knowledge. I think our people would do, if they knew better, they do better. I just feel that they just don't know some of the things you're talking about. They don't know how to eat right. They don't know how important it is if they don't vote. They just have never been taught financial literacy. And I think you're right. It does start with the community, and it does start with each one of us.
And so is that structural racism? I mean, so when I think of structural racism, I think of systems being made so that I am left out.
Oh, that's good.
That's good. Really, really important.
I haven't looked up the definition lately, but I think of in systems being made, whether intentional or unintentional. I got to do my research on that so that certain groups can be left out. Now, there is no question. We all know that. But where I'm at is in an empowerment space. There are books. There are libraries. We passed the day that a child that looks like me can't go to the library.
Yes.
Right? So I have to say, at some of this, it's choice. I used to go to a library and read a book and educate myself. I can read. I may not be a scholar, but I can read. Or do I choose to sit and do something that's not going to really benefit myself, my company, my enrichment? So I'm kind of one of those, I want to teach you how to fish so you can continue to fish, right? Continually giving you fish. Because just economically, we don't have a system that is set to continually. Now, certainly there are those populations that, no question, we need to support. I'm totally there. But I'm also, what can we do for us? What can we do? I mean, if others can come to this country and come with nothing,
and build up.
And build up to like to lead
the American dream. They come for the American dream and implement
it. With their dreams. Come on now. Come on, Yvette. Let's talk. You didn't get to where you are. I know I started mine with $400 on my mother's credit card and didn't know what I was doing. But I was determined. I wasn't stopping. And every time I heard somebody tell me, no, it was not over. No to me meant not over. Y'all get it?
Yes.
Over.
Yes.
N-O, everybody.
Yes.
N-O, not over. But you got to press. You got to get up off the bed in the morning. You may have to stay up a little later. You got to you can do it. And you know, absolutely. I'm going to end with this. With God, all things are possible.
All things.
Right? He don't send you to the possible places because it wouldn't be him if he did. But how I know that, if you really know my story, then you know Gene Drummond there's something else behind this story that's much greater than me. I'm just a vessel. And so I want to come with a message of empowerment. You can do it. Make a choice just today. If you got an apple on your counter versus them chips or them cookies, make the choice. Make the choice.
So you know something, Gene, you said that I think is really a 3-part series. We wrap up next week or sometime very, very soon. We talk about the home policy. We actually need to have an individual health home policy. Maybe we need to have maybe HCD will develop one for all of us and we can come down to and download a home health policy that we have our own contract inside, because I think we come home, we think we can just have at it. But what you're saying is bring some structure there. Then we look at the provider level in terms of policy and then the community. Now, I know that Anthony, you burning with the comment and the question. I know we're almost out of time. We're not out of time.
We're out of time.
Okay, we're out of time. Okay.
Gene, if I can call you Gene, we got to have you back.
Yes.
You are a wealth of information. The energy is off the chain. That's the kind of dynamic that is so key to really getting people's attention. Because listen, you got my attention. I'm just listening to you, and I'm saying I'm bursting because you're spewing out a lot of information, but the energy behind that is so important. We got to have you back. Unfortunately, we're out of time, and so segment number 2 is next, and got to watch the clock. So Linda, could you just kind of close us out, and then
I will close this out by putting the bug out there for the whole wide world to hear, is that maybe Anthony will give us 2 hours on a special section. So I'm just going to put that out there.
But wait a minute. That's what our health is. Remember we said, okay, we have grown up, right? We're grown up now, okay? We're now going from where it was just going to be 1 hour, a segment, to our health is going to be as often as you want it to be based on what you can produce. So you got it. You asked for it, Linda. You got it.
Great. So then I'm going to say this. What we want to end with is a big fat thank you to Ms. Gene Drummond, President and CEO of HCD International. Check it out, hcdi.com, correct? Did I get that correct? hcdi.com, to understand all the fantastic services offered by Jean and her remarkably competent team in the area of policy transformation, social media, and a host of other services that are delivered in the community. Thank you for this week's program, and we look forward to your listening in and viewing in next week as we continue this conversation.
All right. Thank you so much. And guys, I second that, of course. Ladies, thank you so much, Linda and Yvette. Coming up next on segment number 2 is the Blue Economy Opportunities with my colleague, Terry Coxum. She's going to give us an update. I believe CDC has come out with a sort of an extended moratorium on evictions. And Terry is going to give us a report and update on that while we also talk about the blue economy and the opportunities. Folks, until next week, stay tuned. We'll be right back.